Hi, my name is Constance Whitrock, and I am sharing with you my presentation on Skills Lab training for nurses as partial fulfillment of the oral comprehensive examination for the master's degree in nursing education. Education is the most powerful weapon which you can use to change the world. Nelson Mandela. What are skills labs for nurse training? Well, they're specifically equipped practice rooms which allow for safe practice of skills before performing in real-life application. Provides procedural skills such as IV, Foley insertion, those kinds of things that can be repeated, practiced, and evaluated. It allows for feedback in the moment and reduces the anxiety of the nurse, which we're going to talk about. What are the types of skills labs? Well, there's clinical scenarios, head-to-toe physical examination, live models for specific types of exams such as pelvic, breast, skin assessment exams, simulation-based labs and feedback, trauma-informed case-based dialogue role-play scenarios such as in psychiatric nursing, specific skills required for nursing such as IV insertion, Foley catheters, and specific skills that can be repeated. Where are skills labs used? They're used in universities and schools of nursing, hospitals and clinic settings for general nursing specialty trainings, and also the American Heart Association, trauma nursing core courses, and the sexual assault nurse examiner trainings are just some examples of some. Here's my Peacock question. Does a 2-day sexual assault nurse examiner skills lab increase registered nurses' confidence in performing a pelvic examination for evidence collection? What's the significance of this topic? Well, when SANE or forensic nurses perform sexual assault nurse examinations, they have responsibilities for also law enforcement, and this evidence is used in court proceedings and is essential that the collection of DNA evidence is properly collected, sealed, and it follows the chain of custody for legal purposes. The pelvic exams that are needed, require a certain advanced skill for evidence collection, the identification of injury versus normal variant, or the infectious disease process. If that's observed, we refer that to a specialist. What's the significance of a 2-day skills lab? Well, it reduces the stress and anxiety of a new forensic nurse, increases confidence of the registered forensic nurse when performing a pelvic examination for evidence collection, and the case studies that are used in the 2-day skills labs allow the registered forensic nurse to rehearse scenarios that improve critical thinking and application, also reduces errors. How is it significant specifically for the F&E? What do they encounter? Well, F&E new nurses struggle with lack of support and work alone in rural areas with little opportunity to develop these skills. And the lack of knowledge of the skills required contributes to a shortage of forensic nurses because they don't feel confident in their skills. Here's the teaching case study. OJ is a 28-year-old registered nurse with 6 years of experience in medical surgical nursing. Recently took a 64-hour didactic course to become a sexual assault nurse examiner, works in a rural area for a small hospital. She'll be on call for sexual assaults in intimate partner violence patients. OJ's performed one exam through the assistance of telehealth SANE Safe and hopes to increase her confidence in evidence collection by attending a 2-day skills labs and performing pelvic exam for evidence collection. So, sexual assault nurse examiner, the clinical skills lab follows specific guidelines, and these guidelines are out of the International Association of Forensic Nurses. So the first step is that the SANE nurses are required to have completed a 64-hour didactic course prior to taking the 2-day skills lab. That way they can apply their knowledge and practice those skills in a skills lab. And this course focuses on adult, adolescent, pediatric, sexual assault topics, trainings that adheres to the IFN educational guidelines for best national practice when caring for sexually assaulted patients of all ages. Then, after they've completed that, they do the SANE nurses 16-hour clinical hands-on training with live models. The training skills labs, they perform pelvic exams for evidence collection, strangulation. We'd go over medication, charting, and case scenarios. Some additional guidelines put out by the International Association for Forensic Nurses. We teach the identification of female genital anatomy. We describe mechanisms of the use of T-blue or toluidine blue for injury identification, proper use of catheter for hymen visualization. We describe and perform the speculum exams as discussed, injury identification, sexually transmitted infection prophylaxis, pregnancy prevention medication options, reporting options, forensic photography, history taking, physical exam, and case studies for practical application. Now I'm going to discuss a little bit about some of the articles that I did in this for this lab's clinical skills labs. And this is Practical Clinical Training in Skills Lab, Theory and Practice. It was a systematic review, including meta-analysis of 6 skills labs. Training studies were reviewed, various levels of evidence. And the goal was to review the literature on development of skills labs and how these training improves skills labs and critical thinking of participants. And this was based on narrative and selective literature review. The authors were experienced in teaching and in hospital teaching as well, and they selected PubMed for the most relevant references. The skills labs were needed. The result was that the skills labs had strict learning objectives, and that could not be replaced by general, that it was very important to have specific learning objectives. Did not always need to be led by faculty, but trained peers such as PALs, they also could be effective. And that the significant finding was that the simulation labs shown to have positive impact on the students' learning and knowledge and application, but it does not replace the real-life patient experience. So they did show that the students did have positive reviews. The next is simulation exposure improves clinical skills for postgraduate clinical care nurses. So this study was performed by having the students in an MSN NP critical care program be assessed in 4 primary care areas in response to a respiratory patient that was deteriorating. The 4 main milestones, there were 44, and then they grouped them into 4 main milestones, were graded by an independent assessor who was unfamiliar with the student's group or simulation training that was presented, so that there would be reduction of bias. The data results were presented as mean. Unpaired students t-test and Mann-Whitney tests were used. It was reported that the test group did significantly better than the control group in 2 areas. That was assessment skills by 35.7% and in emergency management skills by 27%. The other 2 areas were also looked at, and that was primary response to an emergency and consultation to the doctor. So this showed that you have to have gap analysis in order to see where the skills deficits are. Because just because you go over it in simulation lab may or may not improve someone's ability to perform a certain task. So that's very important. Next is evaluating competence and confidence using simulation technology. This was a mixed methods research using both quantitative and qualitative research design, high level of evidence, pre and post test and end of project summative evaluation was used, and clinical competency questionnaires were administered. There were 40 students in BSN sophomore year. They had to have various introductory fundamental nursing classes, and then there, of course, all of their prerequisites. Simulation labs began with 3 sections. They met for a total of 48 hours, and then after 8 weeks, a post-test, the questionnaire, and clinical skills were evaluated. And the significant findings of this was that the post-test measured an increase in 37.26% of how the students felt that they were prepared after the skills lab. The clinical skills were also compared to what the student thought they had achieved and compared that to the faculty. So 30 of these students of the 40 actually graded themselves lower than faculty, which was not real surprising. But overall, after the pre and post test were done, it showed that the students had their perceptions of uncertainty were reduced after the skills lab. Next article is Training Nursing Skills, a quantitative study of nursing students' experiences before and after clinical practice. So this was a descriptive quantitative design, high level of evidence, contained elements that characterized clinically controlled trials and cross-sectional study. It was a first-year BSN students prior to their first clinical experience. 160 students randomly were divided into two groups, a control and a project group. And this was a little interesting because the project group had a facilitator, or their teacher had a approach of hands-off, did not do a lot of intervening within the clinical skills lab in leading or when coming in and given advice during a scenario. And the other group, the control group, had a more traditional approach to the clinical instructor, and they had more involvement. And in the project group, they were significantly less satisfied with the organization of the training session and had a little more anxiety during the clinical experience when compared to the control group. But overall, the perceptions of effort and mastery of clinical skills scored between 60 to 90% after the training. So it did show that it improved overall, but the style of the teacher also has something to do with how satisfied the students were. What's the research summary on the impact of clinical simulation labs and skills labs? Positive impact in students' knowledge, skills, and application, enhances the cognitive learning process for students, improves skills and clinical performance and critical thinking, reduce feelings of uncertainty of the students, resulting in greater performance and higher satisfaction, and perceptions of effort and mastery of skills improved with clinical labs with involvement of the faculty. Now, what are the gaps of analysis and why do we do them? It's used in an academic setting to improve teaching strategies, and it needs to identify knowledge, which is the cognitive domain, skills, technical domain, and practice, behavioral domain deficits. Learning objectives should reflect the three domains in simulation and needs to be specific, measurable, and observable, and it needs to reflect the needs identified in the gap analysis. So it's very important that what this shows is that without doing gap analysis, we don't know what the student needs. So what we found was that there were lack of knowledge and application regarding difference in what a skills lab is versus simulation lab. What is known about the outcomes of simulation and how to apply these outcomes to learning objectives. Lack of knowledge regarding participants and facilitators. Need for more structured, rigorous, multi-site studies and studies that focuses on the student and the patient outcome. And lack of research and knowledge of needs regarding the skills of employees or students. So what are the implications for the advanced nursing practice as nurse educator? Well, there's a lot of them. I'm going to mention a few. Nurse educators are responsible for providing challenging and valuable experiences that meet the clinical skills needed for RNs to safely execute these skills. Advocate for additional funding for more training programs and clinical skills labs aimed at enhancing new nurses and those transferring from other departments. And that's hard to try to find the funding. Tackling the challenges of hiring skilled and experienced clinical educators. We know this is a hard job market right now, but we need to try to take that challenge on. Utilizing gap analysis to assess learning gaps in cognitive, technical skills and application in order to tailor skills labs to the learner or the new nurse. Providing nurses with innovative and creative learning environments that promote the advancement in skills and application of knowledge. Utilize evidence-based teaching methods as it applies to skills and simulation labs. Now, the specific nursing theory, I started out kind of with humanism as it's a student learner approach, and that we as faculty believe in the student and that they can be active in an agent for change. And so then I narrowed that down to Patricia Benner's novice to expert theory, the nursing theory. And what is our role? Well, we help nurses develop skills, knowledge, and application of knowledge over time and with practice. That's what Patricia Benner, novice to expert, says, that nurses over time will develop these skills. Learning is student-centered. Faculty or their mentor creates an environment of mutual respect and collaboration. Students move from one level to the next in an environment of learning skills that build on each other. And the 5 levels of nursing experience in this theory is novice, advanced beginner, competent, proficient, and experienced. Now remember that these levels can be revisited several times during a nurse's career. Moving from one area to another often means that one starts as a novice again and needs to move toward expert over time. But based on experience and knowledge, the skill and application is easier to master each time. What is some ethical decision making? There's a lot in here, but I'm going to give 2. A registered nurse working as a sane nurse omits the proper chain of evidence for evidence in a sexual assault case. Big deal. This has a lot of implications. There are certain laws that decide what is a mandatory report for consent in all states. Who's responsible for conveying these laws to the new sane nurse? It's our responsibility as the teacher, as the facilitator, as the educator in that department, that we give our new nurses the knowledge that they need so that we are not just thinking they're going to passively know this information. We need labs, we need clinical scenarios, and we need repeated things to make sure that these nurses know what they're doing. Now, the NLN, here are the core competencies for nurse educators. So I'm going to give some examples. Facilitate learning by creating innovative teaching and learning activities using evidence-based practice and technologies. Facilitate learner development and socialization by assisting students to develop as nurses through simulation and clinical skills labs, individually assessing the needs of the student and new nurse, taking into account cultural at-risk consideration, and assist the student in thoughtful reflection and peer evaluations. Use assessment and evaluation strategies. How's that done? By creating assessment tools, performing gap analysis, update courses, and support educational goals. Participate in curriculum design and evaluation of program outcomes by designing curriculum that reflect current practice and theoretical framework. Function as change agent by being involved in local and state nursing service organizations, being involved in educational leadership opportunities within the hospital, the university, or the government. Pursue continuous quality improvement in the nurse educator role by attending conferences, workshops, and seminars and supporting other faculty members looking at feedback from peers and students. Engage in scholarship through continuous education and becoming knowledgeable in specific fields, sharing this knowledge in publications and research presentations. Function within the educational environment through collaboration with other disciplines and participating in committee work within the school or academic institution or hospital where the educator serves. Here are the essentials, the 10 domains for nursing by the American Association of Colleges of Nursing. Knowledge for nursing practice. This encompasses the integration, translation, and application of knowledge from other disciplines, including liberal arts, natural science, and social science. Person-centered care focuses on the individual student and is holistic, evidence-based, and is delivered in a compassionate way. Population health focuses on the prevention of disease, management of disease, and health promotion as it affects communities and public health entities. Scholarship for nursing practice is a synthesis, translation, application, and sharing of nursing knowledge in order to improve the health of the people and to continue improving healthcare in general. Quality and safety in minimizing the risk for harm to patient and the delivery of healthcare is of high quality and is effective. Interprofessional partnership is the collaboration across the professional disciplines, team members, and families and patients in the healthcare system, and to coordinate safe, quality care to diverse populations. Informatics and healthcare technologies is a way to improve safe, quality, high care and healthcare that will improve practice and delivery of care to the population, which entails gathering data, which is used to make more and more informed decisions. Professionalism is a basis for the nursing profession in that it cultivates perspective, accountability, and is reflective of the individual nurse's character, integrity, and value. Professional and leadership development involves activities that encourage personal health, well-being, and lifelong learning. In summary, OJ completed the 2-day skills lab. She learned proper evidence gathering techniques during the pelvic exam and was involved in properly sealing and handing off her evidence. Evidence shows that the clinical labs and simulation labs reported feeling more confident and better prepared. The theory I used was novice to expert. Thank you. And here are my references.